Hi everyone, this is 1 year on. I'm Alison, and following on from my previous episode, today's episode continues the interview series, and I'm fortunate to be able to interview my wonderful speech therapist, Laurie. I need to read this disclaimer to you. This episode is general information, it's not medical advice, and doesn't replace assessment or care from your own clinical team. If you have concerns about your health or recovery, please seek advice from a qualified health professional. So this episode continues interviewing Laurie. We continue chatting about speech therapy and what it involves. I hope you enjoy it. And so that's the interesting thing in the hospital. When I was there, the neurologist, the older gentleman who came around with his hordes of interns, he's going, well, you sound fine to me.
Yeah.
And I'm sitting there thinking, I'm really not fine.
Yeah.
And this is before I knew I had a stroke. This is before they'd done the MRI. And I'm sitting there going, something's not right.
Yeah.
So it's, and Andrew and I have spoken about that a lot in the sense of, well, this person doesn't know you before.
Exactly.
This is the first time they've met you. They might normally be meeting people who can't talk at all, or their speech has been very, very impacted. I have a person I know who could only nod, say yes and no.
Yeah.
That she's shared that with me, and I think, well, I could have a normal conversation, but some people can't because the impacts of stroke are so unique. Each person's experience is very different.
And I have learned along the way, and when I had feedback from different people, I really don't ever say, oh, your aphasia is very mild, it's fine, because somebody may be classified as having mild aphasia, but it may have a huge impact on their life. We just don't know that. And so everyone's experience is different, and it's not, and absolutely as the clinician, it's not for us to make that judgment. And I found that helpful to remember.
It's findings that you get. It's all analysed and the statistics and all sorts of things done on it, right? How does that translate into a therapy plan? Because, in terms of you've got to choose the quick wins, I suppose, and the things that people have got to put more effort into that you tackle later. How do you work it all out?
Yeah. In my setting, being in private practice, I'm getting people a bit further down the track. And so it's really driven a lot by the individual. So, we take our assessment and analyze the areas. I mean, sometimes, sure, we may go through scores and data, but a lot of times there's a bit of a subjective component. And as I mentioned, in uni, we get trained of, you must do every assessment area and get the score. And then, reality is the person's in front of you and you're really going to do the assessment that will make the most sense. So sometimes it is a bit, we get some scores, but also use a bit of subjective interpretation. So we look at all the areas and can say, okay, auditory comprehension seems to be quite good. We can see a deficit in verbal expression, specifically word retrieval or, this and that. But then it's going back to the individual to get to know them a little bit, what their lifestyle is, their expectations, what they're wanting to get out of therapy, and that really helps drive the goals. Because I think about your situation, we knew, we're trying to get you back to work, and you had the motivation and drive to really improve as much as possible. And so that will be different for someone else. I've worked with other people who they've still got some working memory difficulty, but they're saying, what, for my lifestyle, it's really okay. I've got strategies in place to compensate, and I can go through my daily life functioning quite well, so I'm not worried about it. So that's where I rely on, looking at their life, their values, combining that with what we know from research and experience as a professional, and just bringing that together to develop a plan.
I was very driven. I'm still very driven.
Yeah.
And it's actually quite interesting. I think that's probably what's, kept me going.
Yeah. Yeah.
And I didn't actually realize how driven I was until this whole experience, in terms of what my goal was or what I wanted to achieve and things like that. So it's been a really interesting experience for me.
Yeah.
After stroke, what are the most common communication challenges that you see, and how would they tend to show up day to day?
Gosh, they can vary quite a bit. And I think the day-to-day part, so let's talk about, language and aphasia, because that was one of the areas that you experienced. So, a person may struggle to comprehend more lengthy or complex information. I actually see that quite a bit. And so, they may feel pretty comfortable with the basics of, a basic conversation or following simple directions in a task, but then they realize, like, oh, when I'm needing to listen to something that's new and a bit more complex and may have, detailed instructions, that there's some difficulty there. And same, like, a lot of times people will complain of word retrieval difficulties, and they'll be saying, I'm just going along and then I just can't get the word. And sometimes as we unpack that a bit, sometimes it's the specific word that they're just having difficulty retrieving. It's that tip of the tongue feel where you know exactly what you want to say and you just can't get the word for it. But sometimes it might just be organizing thoughts and formulating them into language. And so it's doing a bit of teasing out, okay, where is the word finding difficulty coming from? So I think those are, with a higher level of aphasia, that's often the complaints. And so when people have more significant language issues, it's quite a bit more evident, where they are having, they just are drawing a blank, can't get their idea out because they just can't get the words out. Yeah, so that's on the language side of things that we see.
That's really interesting, isn't it?
And then as far as, motor speech, sometimes people have muscle changes in their muscle function, so it's just kind of a slowed, it might sound a little bit like slurred speech, or motor planning. And so again, the brain knows what it wants to say, but when the message is getting sent to the muscles, it's like the wires are getting crossed and it's just not, they can't execute the word correctly.
So there'd be a lot of frustration there.
Lots of frustration with that, yep.
And would you train someone who's got these motor issues? Is it the same sort of training that you just literally, it's repetition?
A lot of repetition, yeah. And especially like early on, you're trying to retrain those connections. And so there are various kind of methods of going about treating it, but it's, a lot of repetition, and as well as trying to balance that with strategies to help the person be able to communicate if speech isn't going to happen in the moment.
I never knew the word aphasia before I was told that this was what was affecting me. And it was, for me, I would go along a road and then there would just be a gap. Yeah. It was almost like there was a cliff and there was nothing there. And I had to grapple to find this word that I knew what it was, but it just wasn't there in front of me. So I can't even explain it any other way. Yeah. I mean, that has improved, of course, but, I've even had moments of aphasia during our conversation. So it still does happen. Yeah. When I'm getting tired or when I'm in a more complex conversation. Yeah. And certainly, as you said before, the thing about when there's a large piece of text, say, if I'm reading something where it's just really dense, or listening to, say, a speech or something that's really, really dense, it just gets overwhelming. Yeah, okay. Yep. Yeah, and that's even nearly 2 years on. Yeah. Yep. I still have that overwhelm. Overwhelm for me is still an issue. Yeah. And it has got better, but it's not gone. Yeah. Which is annoying. Yeah. Right. What can you do? Right. I'm very fortunate. What sort of issues can there be if someone's having trouble using their mouth to form the words clearly? What actually could be going on?
So that's when it could be that motor planning and execution that's called apraxia. And so that's where, it's in the brain and the nerves are sending the message and it's getting a bit mixed up. So that's called apraxia. Or if it's the actual muscle function, so there's muscle weakness and the muscles aren't able to work as quickly and efficiently, that's called dysarthria. So those are the two motor speech areas. And so there's different ways of treating those. But that's the actual speech component, where probably most people think of speech therapy. Yes, we are working on the actual speech component.
It's fascinating.
Yeah.
There's all these different sort of terminologies for every single individual bit.
Yes,
you know?
yeah. And so
you gather all these terms that are actually quite complex.
And they intertwine a bit as well,
Yeah.
because a lot of people that have aphasia have apraxia.
Oh, really?
And they go, and
Okay,
so
hand in
then
hand.
as you work with someone and as they're getting more language recovered, then you're kind of, sometimes that's when you see like, this is actually more of an apraxia issue, but they're, they cross over so much. And so dealing with both of those is very difficult. Yeah.
Wow.
I feel for someone. Yeah.
Yeah, that's really interesting. So with therapy target coordination, strength, timing, for example, how does that actually work?
Yeah, so probably yes to the above. When we're looking at a motor speech, we'll take dysarthria when it's the muscle function part of it. We're again doing an assessment to look at, or is it a lack of, breath support and efficiency? Is it actually the articulation, the sounds are not sounding clear? Vocal quality can be impaired because again, your vocal folds are innervated. It's a neurological issue.
Wow.
So sometimes a vocal fold may be not functioning as well, which causes vocal hoarseness, resonance. It gets quite complicated. You have a soft palate at the back of your throat that's shutting off to not have you sound severely nasal, and if that's not functioning as well. So we look at the different areas, and I mean, generally in the research, there's a recommended, focus. I think a first order is maybe the breath support and efficiency, and the resonance is actually recommended to focus on first before the speech sounds. But again, it's looking at the whole picture, looking at the individual, figuring out what's going to help them be understood better, because in the end it's about being intelligible and finding a way to work on the speech, as well as if they need to use a voice output app for a while,
to help.
Other ways of communicating to help.
There are so many things now that we can use.
Yeah, technology, it's so much better now, and we have so many more options, so that's really helpful.
It's funny, you were talking just as you were talking there, and I was thinking back, sometimes I do have a little bit of slurred speech. Most people wouldn't recognise, but sometimes whatever it is I'm doing here, it comes out a little bit blurred.
Yep. Yeah.
So maybe I have got a little bit of that.
You very well could be. And I mean, your stroke was
unusual.
Yeah, a bit unusual in the part of your brain. Do you mind if I
No,
say,
it's fine. We've shared it before. The basal ganglia.
I looked it up and went, oh yeah, basal ganglia. I remember that now.
It
is
weird.
Like a control center kind of that can affect so many brain functions. So you could have had a little component, because even people who I find their speech recovers to, we think, wow, you're pretty much back to baseline. Generally, they will always have a bit of trouble when they're tired. I had a pretty bad sleep last night because the dog escaped out his crate in the middle of the night. So that was interesting. That's the end of our second part of the interview with Laurie. If you have enjoyed this episode, please like, share and subscribe. I will be back next time to share the third part of the episode with Laurie. We continue chatting about speech therapy and things that people experience. Thank you.